According to the US-based Center for Disease Control, autism spectrum disorders affect every 1 in 150 children. The current prevalence in the Cayman Islands is unknown because most cases go undiagnosed. But what is autism and how might it affect your child?
A developmental disability is a group of lifelong disabilities that can include mental or physical problems up to the age of 22. They pose a serious impact on individuals, socially, language, in a variety of different aspects. Autism is one of them. Autism is a part of a group of developmental disabilities, which is autism spectrum disorders.
As you know, there are many factors that cause students to struggle academically and within the classroom. And autism is indeed a phenomenon that has received much attention globally in the last couple of decades, and we are really, as a government, focusing and working hard at ensuring that we can provide early childhood educators in the public and private schools on ways in which they can better detect children with autism. We are, of course, going to also provide the training for all teachers to ensure that, irrespective of the child's age, if they've previously gone undetected, that we can now detect them.
The Ministry of Education, Training and Employment has partnered with the Wellness Center to address the situation. They're offering a series of developmental disabilities and autism awareness training workshops for preschool teachers and public health nurses.
The Ministry's role in the developmental disabilities and autism awareness training is to provide leadership within the community so that we can identify children with the particular disabilities at a much earlier age. Particularly, we're focusing early on children on the autism spectrum. And what we've found is, at least historically, that those children were not identified until they were actually well into their primary school years and sometimes in high school already. And one of the problems was obviously access to on-island diagnostic services. But the other issue really is training up frontline workers to be able to identify the signs of a child who might have autism spectrum disorder.
Several of the individuals who participated in the first few workshops have found them quite informative.
I'll be able to share with parents positively, definitely, where they can find help, how they must go about it, and I know I will be talking to them on a more comfortable level as to any disability being observed in their children. With regard to the various agencies on island, I know for sure that there was early intervention, but I did not know of anywhere else we could go or turn to for help. But now we have other avenues at hand we can turn to.
We deal with young students every day, and being in the classroom, there are different behaviors that parents don't understand or parents don't know how to deal with. And as educators, we're able to detect those behavioral problems so we can help parents to get early treatment or help for their child.
No parent wants to hear that their child has autism or any other developmental disability, but early detection can ensure the best possible outcomes for your child. If you have concerns, consult your child's pediatrician or teacher. Preschool teachers and public health nurses who wish to participate in the training workshops should contact the Wellness Center using the email address or number on your screen.
The key to any of these issues, though, is ensuring that we can put together the individual education plan for each student and try to ensure we implement that properly so that each student has the greatest potential for success within our system.